Welcome to the topic Bulimia Nervosa in the Psychiatry module. By the end of this session, you should be able to define bulimia nervosa, discuss the pathophysiology and causes of bulimia nervosa, describe the clinical manifestations of bulimia nervosa, discuss the management approach to bulimia nervosa, and explain the complications of bulimia. Let's get started. Bulimia nervosa, also known as simply bulimia, is an eating disorder characterized by binge eating followed by purging and excessive concern with body shape and weight. There are 5 key characteristics as outlined by the DSM-5 criteria, where there is recurrent episodes of binge eating more than average person in a 2-hour period, accompanied by a sense of loss of control, repetitive inappropriate compensatory behaviors to avoid weight gain such as excessive exercise, fasting, laxative use, and diuretic use. This eating behavior occurs at least once a week for a period of 3 months. Body shape and weight influence self-evaluation, and this does not occur specifically with episodes of anorexia nervosa. While the exact cause of bulimia is still unknown, bulimia nervosa is likely brought on by a complex interplay of factors which can include emotional and personality disorders, family stress, possible genetic or biologic susceptibilities, and a culture that is obsessed with body image and thinness. Divorce, the loss of parents, emotional, physical, mental, sexual, and verbal abuse, bullying, and neglect are all strongly linked with the development of a mental health disorder or low self-esteem, resulting in harmful eating disorders such as bulimia. Girls and women are more likely to have bulimia than boys and men. Bulimia often begins in the late teens or early adulthood, and factors that increase one's risk of bulimia may include biological factors, which are genetic link, psychological and emotional issues, and dieting, where people who diet are at a higher risk of developing eating disorders. Patients with bulimia nervosa may experience the following symptoms, which include dizziness, lightheadedness, and palpitations, as well as dry skin, which all belong to the general clinical manifestations in bulimia. Then we have gastrointestinal symptoms, where one might have pharyngeal irritation, abdominal pain, more common among people who self-induce vomiting, blood in the vomitus, and gastroesophageal reflux disease. Next would be reproductive symptoms, and these include amenorrhea, which occurs in up to 50% of women with bulimia nervosa. Finally, we have uncommon symptoms, or in most severe cases, you'd expect to see water and electrolyte disturbances, where one would have dehydration, hypokalemia, hypochloremia, and metabolic alkalosis, cardiac symptoms such as edema, ECG changes such as QT prolongation, increased PR interval, increased P wave amplitude, widened QRS complex with a depressed ST segment. Gastrointestinal symptoms may include gastric dilatation and Barrett's esophagus. And finally, pulmonary symptoms may include aspiration pneumonitis, which is uncommon, and pneumomediastinum, which is pretty rare. Physical findings may include bilateral parotid enlargement, dental damage, the Russell sign, which is defined as calluses on the knuckles or back of the hand due to repeated self-induced vomiting over long periods of time, cutaneous manifestations including sudden diffuse hair loss, acne, dry skin, nail dystrophy and scarring resulting from cutting, burning, and other self-induced trauma, bradycardia or tachycardia, hypothermia and hypotension, edema, and also clinical obesity. Since bulimia nervosa has numerous medical complications, a complete physical examination is important in patients with this disorder. The examination should include vital signs and an evaluation of height and weight relative to the age. The physician should also look for general hair loss, lanugo, abdominal tenderness, acrocyanosis, jaundice, edema, parotid gland tenderness or enlargement, and scars on the dorsum of the hand. Routine lab tests in patients with bulimia nervosa include a complete blood count with differential, serum chemistry and thyroid profiles, and urine chemistry microscopic testing. Depending on the results of the physical examination, additional lab tests such as chest radiograph and an electrocardiogram may be indicated. And finally, patients who engage in self-induced vomiting should be referred for a complete dental examination. Because of the multifaceted nature of bulimia nervosa, a comprehensive psychiatric assessment is essential to develop the most appropriate treatment strategy. Imaging studies are not routinely indicated or ordered for uncomplicated or typical cases of bulimia nervosa. Nonetheless, there has been growing interest in the use of neuroimaging techniques to explore the structural and functional brain changes that take place in those with eating disorders. Because the potential for arrhythmias and cardiomyopathy as possible complications of bulimia, an ECG should be performed in patients who are very thin, complaining of palpitations, or have other signs or symptoms of cardiovascular concern. Because of the potential for osteoporosis, a dual-energy radiographic absorptiometry or DEXA scan may be useful, particularly for patients with irregular menses or who have mood disorders and/or who smokes cigarettes. Next, let's take a look at the core non-pharmacologic interventions for bulimia include cognitive behavioral therapy or CBT, cognitive behavioral enhanced therapy for patients with more complex cases including comorbidities involving personality disorders, interpersonal psychotherapy, nutritional and rehabilitation counseling, and family therapy. As for pharmacologic agents used in the treatment of bulimia, fluoxetine, other antidepressants, and mood stabilizers such as lithium can be used. For complications, bulimia may cause numerous serious and even life-threatening complications. And these complications include negative self-esteem and problems with relationship and social functioning, dehydration, heart problems, severe tooth decay and gum disease, absent or irregular periods in females, digestive problems, anxiety, depression, personality disorders or bipolar disorder, misuse of alcohol or drugs, and self-injury, suicidal thoughts, or suicide itself. So to summarize, we have seen bulimia nervosa as an eating disorder where the person binge eats and then purges themselves. Let's follow the DSM-5 criteria where we identify the characteristics of bulimia nervosa. We have looked at the pathophysiology and causes as well as the signs and symptoms, investigations which can be done bedside, lab and imaging, as well as functional studies which can help exclude other comorbidities, and treatment plan which include a core non-pharmacological approach with an adjunct pharmacology therapy. So we have come to the end of this topic. Thank you for your time.